It's time for another Medical Marijuana Minute from Tetra Health Centers. Here's Scott Ledger and Tracy Lee Young.
I almost feel like sometimes I have to preface every one of these with, we're so early into the research,
Very early.
Right. As we find Alzheimer's patients are having issues. And now Crohn's. And personally, by the way, he wants to remain nameless. He has a job where he's not allowed to use it. But a friend of mine I used to work with in the industry has found relief with it.
Yep.
But he can't go public. And a lot, I think, of where we are now is the dam is going to break when it comes to it. But when it comes to medical marijuana and Crohn's, what have we found out so far?
So what we do know is that there have been trials done on patients ranging in age from 14 to 40. 60% of those were men, so that relates to your friend. The patients have Crohn's disease activity index scores, which is how they measure the severity of their Crohn's disease, that are greater than 200. They did not respond to therapy with steroids, which is typically the way a medical doctor would treat them. The immunomodulators or the anti-tumor necrosis factor Q agents. These are all big words and I'm no good at them. But all that means to me is I want to know the result of those trials. And patients were assigned to random groups. Some were given cannabis twice a day in the form of cigarettes. They contained about 115 milligrams of the THC, which is Tetra hydrocannabinol, or a placebo that contained cannabis flowers from which the THC had been extracted. So the clinical response, which is a decrease in their Crohn's disease activity index, which we talked about earlier, was observed in 90% of the subjects of the cannabis group and 40% in the placebo group. So 3 patients in the cannabis group were weaned from their steroid dependency altogether. And all of those who received the true cannabis reported improved appetite, sleep, and no side effects. At the end of the day, this is, a few trials here and there, but it's all encouraging. And I think further studies with a larger patient group for both non-smoking and smoking intake of medical marijuana really should be done.
The interesting thing I think we'll see on the tail end of all this is, as so many people won't be able to publicly talk about it, is as each state adds medical marijuana, as people with Crohn's disease choose it as a possible cure, the research is going to pile up. And I think we're going to be, well, you and I won't be surprised, but I really think we're really going to see a lot of the science being proven.
Right. I agree. And I think those that are making the decisions are going to be part of that group that see results. We all know that, so many people are on prescription meds and they're not immune to that. So they'll see it. We'll all, at the end of the day, we're all going to be on the same side of the fence and excited about the results we're getting.
Compassion Medicine Medical Marijuana.
Do you have questions about medical marijuana? You can learn more at TetraHealthCenters.com with locations around Tampa Bay and soon statewide for a Tetra healthcare professional near you. Join us again for more medical marijuana minutes and make sure to visit us at TetraHealthCenters.com. Tetra Healthcare, where compassionate care and natural health come together.